Thank you. Thank you. We have a wonderful panel, and I don't want to shortchange their time. Our first panel of the day is going to be talking about the key drivers of obesity and the onset of type 2 diabetes and promising new directions to reduce risk. As with all our panels, we have asked the speakers to do what is very difficult, which is have very brief beginning talks, and there'll be more time then for conversation among the panel and the audience. I will briefly introduce the panel, and there's more detail in your program. The moderator for this panel is Dr. Griffin Rodgers, who's the director of the National Institutes of Diabetes and Digestive and Kidney Diseases at the National Institutes of Health. Our panel members are Dr. Jose Flores, Chief of the Diabetes Unit and member of the Center for Human Genetics Research at Massachusetts General Hospital, and he's Associate Professor at Harvard Medical School and a member of the Broad Institute. Our second panel member is Dr. Ronald Kahn, the Chief Academic Officer of the Joslin Diabetes Center and the Mary Kay Iacocca Professor of Medicine at Harvard Medical School. Our third is Dr. Ashley Gerhardt, Assistant Professor at the University of Michigan in the Department of Psychology. And finally, Dr. Kent Thornburg, who's the M. Lowell Edwards Chair, Director of the Center for Developmental Health of the Knight Cardiovascular Institute, and Director of the Bob and Charlie Moore Institute for Nutrition and Wellness at the Oregon Health Sciences University School of Medicine. And let me turn this over to Dr. Rodgers.
Thank you so much. Well, thanks so much, Dr. Adler, and I'd like to thank the National Academy of Medicine and the meeting organizers for giving me this opportunity to moderate this panel on key drivers of obesity and type 2 diabetes and promising new directions to reduce the risk, and obviously from the last two talks, both here as well as abroad. Let me just show you a few slides. This slide illustrates what you all know is many of the health conditions associated with obesity. And in particular, obesity increases the risk of type 2 diabetes, as well as its complications, heart disease and stroke, but it also is associated with comorbidities such as depression. And as we've heard, there's really an enormous burden of obesity and type 2 diabetes, both here and around the globe. And this makes research to address underlying factors and provide paths for new prevention and intervention strategies, a very important imperative. At the NIH, the NIDDK spearheads broad research portfolio on both obesity and type 2 diabetes. We have an office devoted to obesity research. We co-chair the Obesity Research Task Force. So before introducing the panel, I'd like to quickly provide a few examples of some of the research efforts and areas that we support quickly in the next two slides, several of which will be touched upon in this panel, and then you'll hear more about it later on this afternoon. Now, the boxes shown here, the arrows, show many of the different clinical studies that we support to better understand and to target type 2 diabetes along the entire spectrum of the disease development. Several of these also target obesity. For example, the Diabetes Prevention Program, or DPP, showed that overweight and obese adults at risk for diabetes could lower their risk by intensive lifestyle intervention, diet, and exercise to induce weight loss, or less effectively by using a common diabetes medication, metformin. The DPP has been the basis for the National Diabetes Prevention Program that's spearheaded by the Centers for Disease Control, and the lifestyle intervention recently was picked up for coverage by Medicare. At the same time, we continue to learn about the development of type 2 diabetes and its complications and its risk from an ongoing study of those patients who are enrolled in DPP, the so-called Diabetes Prevention Outcome Study, or DPPOS. It's now in its 15th year. Now, another major effort on the far right-hand side of this chart is called the GRADE study, and the GRADE focuses on treatment. The goal of this clinical trial is to find out which combination of two diabetic medications, metformin and a second drug, is best for achieving good glycemic control, has the fewest side effects, and is the most beneficial for the overall health in the long term for people with type 2 diabetes. And then if you focus on the far left-hand side, we want to work on the earliest stages of this disease, something alluded to by Dr. Dietz. We're trying to address the factors that can affect individuals' long-term risk for diabetes and obesity, such as weight gain during pregnancy and metabolic exposure in the intrauterine environment. The Life of Moms study, and of course everything in the government has an acronym, is testing lifestyle interventions in overweight and obese pregnant women in order to identify effective strategies to improve weight and metabolic outcome, both for the mom as well as for the infant. I'd like to highlight three other areas that are very actively being pursued, which are at the nexus of obesity and type 2 diabetes. For example, in the upper left-hand corner, we support research on different types of body fat, or adipose tissue, including brown and beige fat. Now, unlike white adipose tissue, which stores energy and fat, is the most abundant fat tissue, brown and beige adipose tissue burns energy, stores, and generates heat. And a number of investigators believe that by activating brown and beige fat, this might be a very effective strategy to combat obesity. We're learning a lot about this, and in particular, over the last few years, we've learned quite a bit about the pathways that are being involved in the browning of this fat. We also support, on the far right-hand side, bariatric surgery. It's a type of weight loss surgery that's been shown to be particularly effective in people with morbid obesity, but even effective in people with moderate or mild obesity, including amelioration of type 2 diabetes. We support both clinical research to get at the issue of the long-term outcome and the durability of the effects of this bariatric surgery. And we also support basic studies to uncover the molecular mechanisms through which the surgery exerts its beneficial effect. And ultimately, the goal would be to yield treatments that would be effective without the need for surgery. Now, at the bottom, you see the microbiome, which is really another area of active NIDDK-supported research to explore how the microbes that inherit our gut, their gene functions and their metabolites that they produce, influence obesity and metabolism, and by extension, type 2 diabetes risk. Now, not shown on this slide is an area that we support, and that is the neurobiology of obesity, encompassing both the brain as well as the periphery. It's also at the heart of our understanding of drivers of obesity and type 2 diabetes, and it's important in advancing both clinical and translational research in this area. Let me now formally introduce the panel and give you their order of their presentation. Their very impressive bios are summarized in your program booklets. First, we'll have Dr. Jose Flores, who you've heard is from the Mass General and the Harvard's Medical School and the Broad Institute, and he'll be discussing, can we use insights from genetic studies to reduce obesity and diabetes? Next, we'll have Dr. Ron Kahn from the same Harvard's Medical School, but from the Joslin Clinic, who will discuss, can recent advances in our understanding of insulin resistance be leveraged in interventions for type 2 diabetes and obesity? And then Dr. Ashley Gearhart from the University of Michigan will discuss with us what do we know about how brain reward circuits affect food intake, and can we use that knowledge to change diet? And then finally, Dr. Kent Thornburg from the Oregon Health and Science University and its Associated School of Medicine will discuss what do we know about basic mechanisms underlying intergenerational transmission of diabetes risk, and can we use that knowledge for interventions? So we have a very interesting panel. Let me now turn over the discussion to Dr. Flores.